Good afternoon. Welcome to our presentation, Do the Research Priorities Identified in the SAGE's Delphi Studies Resonate with Rural General Surgeons, a Washington State Perspective? My name is Sarah Lewis, and I am so pleased to present the research being conducted by my teammates and I at Washington State University. My teammates, Athena Hopi, Caitlin Larson, and Veronica Labova and I are all third-year medical students. Our advisor and mentor, Dr. Anjali Kumar, is the Clinical Education Director of Surgery at our state's new College of Medicine. I have no disclosures. Rural general surgeons function in a significantly different environment than their colleagues. Challenges they experience are unique and may not be elucidated unless they are intentionally identified. Understanding their challenges provides insight into their priorities and how we can best support this important group of surgeons going forward. As of 2019, Washington State is ranked 40th out of 50 in the US for active general surgeons per capita. When we began our project in early 2020, of the 400 plus registered physicians in the ACS for Washington, only 10% listed their residents in rural counties. Most general surgeons are located on the western side of the state, concentrated around the Seattle metro area. So, as my colleagues and I were thinking about this specific population, we wondered, first, who are they? Who would choose to be out there, away from colleagues with whom they can share call, away from peers with whom they can consult, and away from the resource-rich environment of urban and academic institutions? We turned to SAGES first because it has made a dedicated effort to identify priorities of its surgeons to better target its resources. We used the 2014 Delphi priorities as a starting point, and we applaud the efforts taken to update this priority list in 2020, published 2 months ago. This brings me to our project goals. As many surgical research priorities are set by urban hospital groups and academic centers, we aimed to hear the perspective of rural surgeons to see if they differed. We wanted to understand the educational and career backgrounds of those choosing rural practice. And finally, we aim to connect these surgeons with each other and with students who are interested in a rural path through a surgical consortium. To do this, we began with outreach. We tracked down contact information, sent letters, and utilized introductory emails from our school to hospital CMOs and rural networks around Washington. We then conducted 30-minute interviews with these surgeons, asking them about their educational path, careers, challenges, and advantages of practicing in rural communities. We then conducted a follow-up survey using the Delphi study to understand whether the research priorities that SAGES sets for funding and inquiry resonated with them. We took this list of 40 published topics and asked our surgeons in Washington to pick their top 5 from that list. We also pursued site visits with the surgeons to get hands-on, ground-level perspectives on their lives, their communities, their surgical teams, and their patient populations. We categorized rural general surgeons as those practicing in critical access hospitals. These are federally designated in rural counties that provide healthcare to large catchment areas. They have 25 beds or less and receive payment based off of reasonable costs instead of fee-for-service. We focused on the 39 critical access hospitals in Washington, and as you can see from this map, that covered a lot of ground. So far, we have contacted 79 rural general surgeons, resulting in 24 virtual interviews, 1 in-person interview, 18 completed surveys, and 3 in-person site visits. Several main themes appeared. These included major limitations experienced by general surgeons, which, as you can see, included encountering ORs and equipment which were very different than where they completed their training. In some cases, very new surgical staff with limited formal training, very few colleagues to consult, significant supply shortfalls, and in many cases, a population that may not even know that they are there in the hospital providing services. With respect to our SAGES Delphi survey, which you can access here if you would like, Many of these themes were reflected in the priorities our surgeons identified. In the SAGE's laparoscopic endoscopic survey, rural general surgeons were most likely to rank these two questions as their top research priorities. Number 8, what is the best method for incorporating new techniques and technology for surgeons of variable levels of experience and training? And number 1, how do we best train, assess, and maintain proficiency of surgeons and surgical trainees in flexible endoscopy, laparoscopy, and open surgery? Of note, the question which resonated with rural surgeons the most was number 8, and only one of the surgeons interviewed agreed with the top 5. We also identified the following areas of concern during our follow-up: how to overcome blood bank and operating room supply limitations, adequacy of resident training for solo rural practice, and how to stay tied in with opportunities for further training and professional development. We concluded that research priorities of rural general surgeons differ significantly from research priorities of surgeons practicing in non-rural settings. Located in northern Washington, above the Grand Coulee Dam on the Columbia, not 20 miles from the Canadian border, lie the towns of Tonasket and Brewster. I spent 2 days with Dr. Rosie Dillon at Three Rivers Hospital in Brewster and North Valley Hospital in Tonasket, where she is the only general surgeon covering these two hospitals. The ORs close in the evening due to staffing. There is no ICU or dedicated step-down. Surgical staff include 2 scrub techs, 1 OR nurse, and 1 CRNA. Although I had interviewed several rural general surgeons prior to this visit, it wasn't until I visited Dr. Dillon and witnessed the limitations she works with daily that I understood the significant sacrifices and challenges experienced by this unique branch of surgery. I walked away with a deep appreciation for rural general surgeons, amazed at what they do. My co-author, Caitlin Larson, visited a small town near the Columbia River Gorge on the Oregon border called Goldendale. Caitlin spent 2 days with Dr. Janine McGilvery at Klickitat Valley Health, where she is also the only general surgeon practicing there. Not surprisingly, starting this project in January of 2020, we faced some significant limitations. Also, as mentioned, the scarcity of general surgeons practicing in rural parts of our state significantly limited our population. These surgeons are not used to having people reaching out to them, so it took quite a bit of persistence to form meaningful connections. As you can see, this project has been a lot of fun. As we continue to investigate, our future goals are to form a consortium of rural surgeons in Washington, rediscuss with the 2020 Delphi list of priorities, and create mentorship opportunities for aspiring surgeons. A special thank you to SAGES. Being invited to come to this conference is a fantastic opportunity for us to present and network. SAGES Medical Student Summer Research Award provided the seed funding for us to pursue this work. If any medical students are listening, I highly recommend that you seek it out. It was immensely important for us. Thank you so much for engaging today. We're open to your questions and ideas.